So we often associate a visit to a chiropractor with back pain, right? But chiropractic treatment could actually be a big part of improving your overall health.
And Dr. Chad Shaw is part of Shaw Chiropractic. Thank you so much for being here. We appreciate it.
Thank you for having me.
We've had you on before to talk about the benefits of going to see a chiropractor, but there's also some things that we might not know that could benefit us that we could get from you if we visit you. Talk about that.
And that's what I'm here today for, because a lot of people initially come to see us because we do help with back pain and neck pain.
And that's what you think of when you go to a chiropractor. You're aligning my spine, and that's my initial thought.
Yeah, the pops and the cracks.
Right,
that's right.
It goes so far beyond that.
Well, each vertebrae is connected to different parts of the body, and I think it's really important to, for people to understand that they can get a lot of benefit from chiropractic with a lot of different health issues.
Well, let's dive into that, because there's one thing in particular that you worked with one person and just changed their life.
Yeah, absolutely. We, one thing that you don't associate with chiropractic is earaches, but we've had tremendous success with otitis media, which is inflammation of the inner ear and earaches. It's a really common problem. It's the most common reason for kids 15 and under to seek medical care.
Yeah, that's so interesting. We actually have a testimonial, I think, from this patient who you treated for earaches. You want to take a look at that?
Yeah.
We were kind of desperate for something, different than what we were doing, and a friend of ours referred us to Dr. Andrea and Dr. Shaw, and it's been a fantastic experience. He saw relief right away.
My name is Grady Wilkins. I'm 6 years old.
Grady suffered with chronic ear infections as a baby.
I would be sick like every day, and my body would be not energized.
He went through a round of ear tubes. We thought we were doing the right thing at the time. So you do what the doctor recommends and hope that it works. When we first did it, I think he was only a year and a half old. It didn't fix the problem. The infections still, kept happening. They would just drain, and not be as painful for him. Andrea knew right away, what the problem was and how to fix it. We started with the ears, because he had some other problems as well. He had allergy problems that triggered asthma problems.
They got all the water out of my ears.
She popped, literally, adjusted his ears, and his eustachian tubes opened right there, and they drained. I mean, I wouldn't have believed it if I hadn't been sitting there, and seen it.
I feel like I'm going to go to school and play on recess and have fun with my friends.
His teachers noticed right away. He was like a new kid.
Way better.
Way better. I'm happy for him. So Dr. Shaw, explain to us exactly what it is that you're doing for the ear like that.
Well, one of the reasons that ear aches recur over and over again, and you heard Grady's not uncommon to go through several rounds of antibiotics, get the tubes in the ears, only to have a return.
Sure.
And if I can go to my model here, I'll show you. The fluid accumulates back here, and you can see that there's a natural drainage called the eustachian tube that takes that fluid out of the ear. And when you get an ear infection, this tube closes off. If you only do antibiotics, the fluid still stays there, and then it's ripe for infection again. If you put tubes in here, and again, as a parent, I have 3 children. Never want to put my kid under general anesthesia if I can avoid it.
Sure.
But as soon as the tubes fall out, the fluid, if this doesn't open, accumulates again.
And that's just from being adjusted in the right way.
It being adjusted in the right way.
That's incredible.
There's vertebrae that connect to the ear that boost the immune system and control some of the muscles that open that tube. And then we also do a specific adjustment on the eustachian tube.
Where were you? Because I suffered from this when I was a kid. I had tubes, I had to go through the antibiotics, the whole 9 yards. And so it's amazing to think that something so simple would have such an impact on such a cute kid too, by the way.
Isn't he great?
Yeah.
A lot of people are like that. This is a big issue. 2/3 of kids by the age of 2 will suffer some kind of ear infection. And we're here to help. We're here to show the benefits of chiropractic care for these types of things. And that's why I'm doing a workshop tomorrow at my office at noon, and then again at 6.
Yeah, well, let's talk about where your office is located, how people can get involved. They can just come, show up. Do they need to register?
Yeah, if they could call the office, let us know, so that way we can accommodate them. You know, our number is 997-1349.
Yeah, which is on the bottom of the screen too, if you gotta jot it down real quick.
Yeah, and so we'll just be basically going over, you know, what it is we do and how it helps and how it can benefit people that are suffering.
And it's safe. This procedure is safe.
Absolutely safe, yes.
Yeah, which is great for parents. And again, you don't want to ever put your kid under general anesthesia if you don't have to. And so this is a solution that they can attempt and come work out with you.
Yeah.
Exactly. We, like I said, we have 3 kids. We do all the things, you know, a lot of times we figure things out with our kids and bring those into the office, show our secrets.
Well, there you go. Well, thank you, Dr. Shaw. We appreciate you for being here and for showing us this. And we'd like to thank Shaw Chiropractic for sponsoring this segment. To get more information, you can do so by visiting shawchirojax.com, which is on your screen. You can also ask them about their seminar that they're going to be doing, 904-997-1349 for more information as well.